Mortality. This SUDEP stands for sudden unexpected death in epilepsy, and the definition has undergone some change because now it's recognized that in observed cases, most of them are associated with a seizure. So status epilepticus, that wouldn't count as SUDEP because that's a complication of, that would be a cause of mortality. But most of these cases are occurring at night, patients in bed, and when observed, such as in video EEG monitoring units or epilepsy monitoring units, there's usually a seizure followed by a systole, respiratory arrest, inability to resuscitate the patient, even with good medical personnel trying to resuscitate the patient. That's the classic SUDEP. The highest incidence is in the young adult age, kind of the college age, and we're all hearing about kids in that age group who are experiencing this. Overall, 1 in 1,000 patients with epilepsy each year experience SUDEP. Now, the high-risk group is the patient with intractable epilepsy, escalating seizures. In that group, sometimes we call this surgery candidate group because they're being evaluated for medically intractable seizures as high as 1 in 150. Now, in a new onset patient, the figure that's used is 1 in 10,000. If you're seeing someone with new onset epilepsy, it's a very minuscule risk of SUDEP, 1 in 10,000. But as they start to live with epilepsy, the risk goes up, and it goes up cumulatively. This is a slide from a paper published in Neurology last year by Orrin Davinsky and others, looking at overall mortality in epilepsy in the U.S. in 2014. And you can see that, well, this, when I say mortality, we're talking about earlier mortality than expected. And SUDEP is the most common cause, followed by injuries, status epilepticus, suicide, and then drowning.